Hi, my name's Georgia from Bien Australia, and today we're going to go through how to actually use your pelvic floor wand. So let's say that you've been given or recommended or seen that a pelvic floor wand could help and treat deeper pelvic floor pain in the deeper part of your hip, pain with deeper penetration. That is what we're going to go over today. There is a separate video talking about how to release the entrance of the vagina in the cases of tight scar tissue or pain with initial penetration. But today we're going to talk about how to get to that deeper layer of the pelvic floor. So if I take my vagina off here, we shall begin. It's almost a little bit difficult. Got it. Okay, so we're going to first of all choose the end of the wand that you want to use. So you've got the pointed end, which is a little bit more like a finger and provides a little bit more of direct trigger point or direct pressure to the area that you want to be treating. So you could use the more pointed end. If it's your first time and you're a little bit nervous or you're worried about causing yourself pain, then you might want to use this more rounded end, which just gives you a little bit more of a broader point of pressure instead of that really targeted pressure. So choose the end of the wand that you would like to start with. You'll notice that the neck of the wand is a little bit thinner than where the part that is going into the vagina is. So that's going to be sitting at the entrance of the vagina. We'll deliberately make that thinner so that it's more comfortable, so that when you're treating, the entrance of the vagina isn't getting a big stretch. So you've chosen your end. I'm going to choose this pointy end. We're going to go into the vagina like you're going a snake down a hole or a worm down a hole. Snake down a hole doesn't really make sense. So let's go worm down a hole. So we're having the C curve facing down towards the bum when you first go in. And the way the vagina is that you're going to have to go down towards your bum quite a bit if you're lying on your back. So if we're going into the vaginal canal, we'll start by going in, and then we're going to go down and choose a side, so left and right. So if you go straight and immediately in, you might just feel a little bit of pressure through your bowels because your rectum lies directly at the base of the vagina. So we're going to go in and then straight to one side. A lot of people, if they're experiencing pain with deeper penetration or if they've just got pelvic floor tension, it's normally through the lateral parts of your pelvic floor anyway. So we're going to go over to one side, and then essentially your job is to be a bit of a detective and find the parts of your pelvic floor that are sore. So using the hands on the outside, it's a little bit like driving a boat or a tender if you've ever driven that. If I turn the wand to the right, it's going to move to the left and vice versa. So whatever's going on the outside is the opposite of what's going on the inside of the vagina. So once the wand's inside, if I'm trying to get to, say, my left hip muscles or my left lateral pelvic floor muscles, because I know that they've been sore with treatment from my physio, I'm going to move my hand to the right, which will make the wand go to the left. Once I find a sore spot, then I'm either holding the pressure I've already got on there, or if I want a little bit more pressure because I found the right spot, then I'm going to bring this hand up towards my belly a little bit more, or up towards my leg. So if I lift it up towards the ceiling or my belly or my leg, that is going to make the wand go down. And likewise, if I need less pressure, if I move this back towards the ground, towards the bed, whatever you're sitting on, that's going to give it less pressure. So that is how you attenuate or change the amount of pressure you're putting through the pelvic floor. So moving it left and right changes the position internally, and then up or down obviously puts more or less pressure through your pelvic floor. When you're doing that pressure, we're aiming for a 3-4 max out of 10, where 10 is the worst pain imaginable. We're not trying to create more pain in the vagina and the pelvic floor, and your vagina is sensitive, so don't go pushing really hard. So we're trying to find that gentle pressure, kind of like you're testing the ripeness of an avocado, something similar to that when we're inside the pelvic floor. I've dropped my wand. You'll probably find that that won't happen when you're doing it at home because it'll be inside the vagina. If we need to get to the front of the pelvic floor, then what I often find good to do is, if you're all the way in and deep and we're trying to get right to the back of the pelvic floor, you might want to pull the wand out a little bit so that you've got a little bit more leverage to get right to that front muscle, which is coming up towards your pura rectalis. So if we know that we want to release up near the urethra or the front of the pelvic floor, taking it out a little bit, and then you're going to want to do almost like a full 180 so that the wand is pointing up towards your pubic bone or towards your urethra. So my hand on the outside would have done that. You can then leave it there to take it out, and as you take it out, you just want to angle it back down so that you don't poke yourself in the urethra or in the bladder, or if it's more comfortable, you might turn it back towards your bum and then take it out. Remember, there is this curve in it, so it's not going to be able to just be taken straight out and straight in. You're going to have to go with the natural curvature of the vagina in order to get it in or out. Now, when the wand is actually inside the vagina, you've got a couple of options. So one is you change the pressure by moving your hand forward and back. The second is that you use some breathing to help relax that tender spot. So you might perform some box breathing, some belly breathing. We've got loads of breathing videos on the website that you can watch and that you can perform while you're doing this. Or you might perform some contract relax treatment through the pelvic floor. So you might turn your pelvic floor on, turn it off, turn it on, turn it off, and with this movement forward and back, we're getting increased blood flow, we're getting increased relaxation, we're teaching the body this is on, this is off. So it can be a really effective technique. If we're on that lateral part of the pelvic floor, you might also be moving your hip in and out. So sometimes when you move your hip in and out, if we're quite tender through that deep hip muscle or the lateral wall of the pelvic floor, you might find that moving it in and out creates a little bit more tension and then a little bit less tension. So again, we're using a contract relax technique, but instead of the pelvic floor, we're using the hips. There's a bunch more videos on different techniques that you can use, but just to give you some ideas. Once you've finished with your wand treatment, you're going to take the wand out of the vagina. You would have already had some lube on it. You're going to wash the lube and then you're going to put it in the bag that was provided with your box or another safe place for it. And then prior to use the next time, you're going to wash it again, make sure that it's all clean, and then you're good to go. A big tip is that if you're using lube, which I highly recommend needs to be water-based, you want to put it not just only on the tip of the wand, but also on the shaft, as this part is probably going to end up inside the vaginal canal. And then you might also want to put it on the entrance of the vagina so that there's lots of lube, less friction, normally means more comfort. If you have any questions at all, let us know. If you want more information, more videos, those sorts of things, then you can head to bien.com.au if you're not already there.